Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into a very important and often overlooked topic, the subtle signs of kidney disease that show up on your skin. That's right, your skin can be one of the first places your body signals that something is wrong with your kidneys. Now, most people don't associate their skin with kidney function. You might think of urinary issues, fatigue, or swelling first. But the skin often gives us silent, early warning signs that something deeper is going on. The problem is, many of these signs are easy to brush off as minor skin conditions or aging. In this video, we'll explore 9 skin-related symptoms that may indicate chronic kidney disease. We'll discuss why they happen, what they mean, and what you should do about them. So if you or a loved one is experiencing any unusual changes in your skin, especially alongside other health concerns, stay with me. This video might just save your life. Let's begin with one of the most common and subtle signs, dry and flaky skin. You know the kind of skin I'm talking about. It feels rough, tight, maybe even itchy. You slather on lotion, but it doesn't really help. Now, dry skin can happen for many reasons, whether dehydration or even aging. But when it becomes chronic and doesn't respond to moisturizers, your kidneys might be involved. Here's why. Your kidneys are responsible for maintaining your body's balance of fluids, electrolytes, and minerals. When they start to fail, your skin loses its ability to stay properly hydrated and nourished. On top of that, failing kidneys don't produce enough erythropoietin, the hormone that helps make red blood cells. That leads to anemia, which can reduce oxygen supply to your skin, making it feel dull, pale, and dry. If your skin feels unusually rough or flaky for no clear reason, especially on your arms, legs, or back, it might be time to check your kidney function. Let's move on to the second skin symptom, frequent infections or wounds that don't heal. If you notice that your skin is prone to rashes, boils, or even fungal infections like athlete's foot or ringworm, and they just keep coming back, this could be a sign of impaired kidney function. Chronic kidney disease weakens your immune system. When waste builds up in your bloodstream, your body's natural defense mechanisms get sluggish. That makes it harder to fight off even minor skin infections. You might also see small cuts or scratches taking longer to heal. This happens because poor kidney function often goes hand in hand with poor circulation and diabetes, both of which slow the healing process. So if you're dealing with constant skin infections or slow healing wounds, don't ignore it. Your kidneys might be calling for help. Have you ever bumped your leg lightly and ended up with a massive bruise? Or noticed random bruises appearing without any memory of trauma? This isn't just clumsiness. It can be a sign of kidney dysfunction. When your kidneys aren't filtering waste effectively, toxins accumulate in your blood, interfering with normal platelet function and blood clotting. This makes you more prone to bruising and, in some cases, bleeding gums or nosebleeds. You might also see petechiae, tiny red or purple dots on your skin caused by bleeding under the surface. And here's something even more serious. Many kidney patients are on blood thinners or blood pressure medications, which can further increase the risk of bruising. If you're noticing frequent, unexplained bruising or bleeding, don't brush it off. It's time to get a full blood and kidney panel done. Take a close look at your skin tone lately. Has it changed? Is it looking more pale, yellowish, or even gray? Changes in skin color are often missed or dismissed, but they can be significant indicators of kidney disease. Pale skin can be a sign of anemia, which, as I mentioned earlier, is common in kidney disease. Anemia reduces the number of red blood cells, depriving your skin of oxygen and giving it that washed-out appearance. A yellowish tint can result from the accumulation of urea and other waste products in the blood, which affects pigmentation. And a grayish or ashy skin tone can indicate long-standing uremia, where the kidneys are no longer filtering properly. These color changes are often more visible on the face, arms, and legs. They don't come on suddenly, but tend to develop gradually. If people around you are commenting that you look tired or different, don't ignore it. Your skin tone might be telling a deeper story. If your face, hands, legs, or ankles are looking puffy, especially in the morning, it's not just salt or sleep. This is called edema, and it's often an early sign of kidney problems. Your kidneys regulate fluid levels in the body. When they're damaged, they can't remove excess fluid efficiently. That fluid starts to build up in tissues, causing swelling, most noticeably in the lower limbs, around the eyes, and sometimes in the abdomen. This swelling may feel tight or uncomfortable. Pressing on the swollen area may leave a dent that stays for a few seconds. While occasional swelling can happen from sitting or standing too long, chronic or unexplained swelling should never be ignored. If your shoes or rings suddenly feel tighter, or your face looks unusually puffy when you wake up, get your kidney function checked. Let's talk about something more advanced. Scleroderma-like skin changes, often referred to as nephrogenic systemic fibrosis, or NSF. This is a rare but serious skin condition that can occur in people with severe kidney dysfunction, especially those exposed to gadolinium contrast dye used in some MRI scans. NSF causes the skin to become thick, hard, and tight. It may look shiny and feel like it's being stretched. Over time, it can lead to joint contractures and even limit mobility. It usually starts in the legs and arms, but can spread to other parts of the body. In advanced cases, it becomes extremely painful and disabling. The exact cause isn't fully understood, but we know it's linked to both kidney failure and gadolinium exposure. While NSF is rare, it's a stark reminder that chronic kidney disease can have far-reaching effects, even affecting the connective tissue in your skin. Let's talk about one of the most shocking signs of advanced kidney failure. Something you probably never heard of, uremic frost. Uremic frost is a powdery white residue that forms on the skin when urea crystals are excreted to the sweat glands. It's literally your body trying to get rid of waste through your skin because the kidneys have stopped doing their job. This condition is extremely rare today, thanks to earlier detection and dialysis. But it still occurs in people who haven't yet been diagnosed or treated. It usually appears on the face, neck, and chest and looks like tiny flakes or salt-like particles. It may be itchy or have a distinct ammonia-like odor. If you ever see this, or anything that looks like white powder coating your skin, go to the emergency room. This is a sign of end-stage kidney failure and requires immediate intervention. Calciphylaxis is another serious condition that starts in the skin but goes much deeper. This painful disorder occurs when calcium accumulates in the small blood vessels of the skin and fat, causing clots, necrosis, and skin ulcers. The result? Deep black or purple sores that don't heal. They often appear on the thighs, abdomen, or lower legs. These lesions are extremely painful, prone to infection, and sadly can become life-threatening. Calciphylaxis primarily affects people with end-stage renal disease, especially those on dialysis. It's more common in patients with high calcium phosphate product levels or poorly controlled secondary hyperparathyroidism. Treatment is challenging and may include sodium thiosulfate, wound care, pain management, and sometimes parathyroid gland surgery. If you or someone you love has kidney failure and starts developing painful ulcers or strange skin patches, seek urgent care. Let's talk about itchy, irritated skin. This may seem like a minor nuisance, but in the context of kidney disease, it's actually one of the most common and persistent skin-related symptoms. Known as uremic pruritus, this itching often feels deep, relentless, and unsootable. Patients describe it as a crawling or burning sensation just beneath the skin. No amount of lotion seems to fix it. When your kidneys aren't functioning properly, waste products like urea and creatinine build up in the bloodstream, irritating nerve endings in the skin. On top of that, calcium and phosphate imbalances, plus elevated levels of parathyroid hormone, can contribute to intense skin discomfort. In many cases, the itching is worse at night, affecting sleep, mood, and overall quality of life. Scratching may lead to bleeding or infections, especially in elderly patients or those with diabetes. There's good news, though. This can be managed. Treatments include antihistamines, moisturizers with menthol or capsaicin, phototherapy, gabapentin, and in severe cases, dialysis adjustment or even parathyroidectomy. If you're experiencing persistent itching, don't just assume it's dry skin. Talk to your doctor, especially if it's paired with other symptoms we've discussed today. Now that we've gone through the 9 hidden kidney symptoms that appear on your skin, let's recap them briefly. Dry, flaky, or cracked skin. Skin infections and delayed healing. Skin bruising and bleeding easily. Discoloration, gray, yellow, or dark in tone. Swelling and puffiness. Hard, thickened skin. Uremic frost. Calciphylaxis. Painful ulcers and skin death. Severe itching or burning. Remember, many of these signs can develop slowly. Some are subtle and easy to ignore, but collectively, they may be your body's way of whispering or shouting that your kidneys need attention. Your skin is a reflection of your internal health. So if you're experiencing any of these symptoms, especially more than one, please don't ignore them. Get your kidney function tested. It's a simple blood and urine test that could save your life. Thank you so much for spending time with me today. I know this was a lot of information, but awareness is the first step to prevention and potentially even reversal of kidney damage. If you found this video helpful, please click that like button, subscribe, and turn on the notification bell so you don't miss any future videos from the Healthy Body. Have any questions or symptoms you'd like to share? Drop them in the comments below. I read every one. Take care of your body, listen to your skin, and until next time, this is Dr. Alex signing off. Stay healthy, stay informed,